SNF units and rehab facilities. Okay, let's get started. For some reason, a lot of home health agencies are not wanting to market to the right places. We are just sitting in our offices thinking that referrals are going to start coming in. Just because we are listed in the Medicare listing, just because we think that we're in the phone book, just because we think you can find us in Google, all of a sudden we're going to start getting referrals. One of the biggest untapped locations for referrals are skilled nursing facilities. We make objections in our heads itself thinking that they already have a home health agencies that they are referring to. Well, yes, that is a right objection, but it is the wrong reasoning to say that you don't want to go in there. Look, if a physician has patients, then of course he needs to refer them to the proper people. Same thing for skilled nursing facilities. Now, we've spent several videos in regards to helping you guys get into hospitals, getting into physicians, but one great source for referrals are skilled nursing facilities, or what we call rehab facilities as well. Remember, these guys have Medicare beds. They are showing and also discharging patients almost on a weekly or daily basis. And if that is the case, why are your agencies not taking advantage of these facilities? Look, it is a lot harder to be able to get into a hospital. Why? You have to go through so many hoops, so many requirements, so many different people. You're going to have to be making phone calls. You're dealing with a lot of gatekeepers that will prevent you from getting to the right person. Plus, they also have their own home health agencies that you're dealing with. Now, with skilled nursing facilities or rehab facilities, some of these companies do have their own home health agencies, but very rare does this happen. So you need to make sure you do everything you can get into that you can get referrals from. You want the hospitals, you want the doctors, and of course you want the skilled nursing facilities. A lot of people say it's hard to get into the skilled nursing facilities. You're only literally dealing with one gatekeeper that's going to prevent you from getting in touch of the right person. Now, each facility can be different. There's going to be some facilities where you have to go directly to the administrator. There's times where you go to the administrator and they will actually refer you to the director of nursing. And sometimes they're going to ask you to then direct you to the discharge planner. Either or, it's a lot easier to get to the top of the facility automatically. Now, first things first, a lot of people say, well, don't do a walk-in into a nursing home. Well, let me ask you guys this. How will you get a hold of them? Are you going to give them a call? Now, of course, we do have cold call techniques that we will show you to get in touch with the right people. But when we do our marketing strategies, remember, we talked about the 7 most important things you need in marketing. But you also need to make sure that you also are calling in or you're doing cold walk-ins, because this ultimately, the face-to-face conversation, that personal touch that I always talk about in regards to marketing is very important. And it is no different into skilled nursing facilities. I've heard them all where there's other consultants out there that says, do not walk in to these facilities. Well, you know what? If you hear that, then that person is inexperienced, because understand this. Look, you need to target every single aspect. There is no reason why you can't walk in. When you're marketing out there, you will do everything that you can. You will do a cold walk-in. You'll do a cold call. You're going to mail. You're going to email. You're going to snail mail. You're going to be sending them so much information because you want to become, once again, first in their mind when they need some services. And I guarantee you that your agency, if you start using the programs, the formulas, the techniques that I've been giving you guys, you'll be able to make yourself more valuable than the current agency that they're currently working with. So yes, do drop in for a sales meeting. When you go in, you don't have to have that meeting right away. Obviously, you want to try to maximize every effort. When you go in for the first time, if you feel or you get some resistance, and I will show you how to get away for or go over those resistance, you can gather information. One part that we need to do in marketing is gathering information. The more information you have, the more availability of you being able to be successful. From getting the right names, from being able to ask the right questions so that they can point you to who you really need to speak to. So yes, make sure you do a walk-in. Also do some cold calling. Actually, I always prefer cold call first to gather all the information that you need. If you do that, you already know who the administrator is. You can gather who already is the director of nursing. You can even get the information on who is the discharge planner. It is easy for you to be able to do that when you cold call or when you first initially walk in to get that appointment. Yes, everyone's busy. And yes, we are going to be bothering people. Yes, we are going to be pressuring people. Why? Because we have to remove them from what they are doing right now. And I understand in the healthcare industry, everybody is doing a lot of work. But so are you. You as a marketer, you as an administrator, you as a director of nursing, there's a lot of things that you're doing. But you also need to make sure you spend some time to make sure that you get referral sources. And this is one place that is an untapped facility. Understand also, when you're going to these facilities, you're spending some time trying to get them to refer patients to you. It goes the same exact way for them. They ultimately also have to make sure that they find the right type of agencies, the great agencies out there that's going to be able to take care of their patients. Most of the time, if they recommend a patient to the wrong type of agency and that agency does not take care of them, that's going to ultimately make them look bad as well. So always make sure before you even do a walk-in, because it is easy to get to the top, find out their names automatically. Understand, when you do an initial walk-in and you did not call ahead of time to gather information, you're going to be walking in, talking to the receptionist and asking them, can I speak to the director of nursing? Or can I speak to the discharge planner? Or can I speak to the administrator? Now, imagine if you have a name already that you can drop. The moment that you walk in, you literally tell them, I would like to see Mr. Smith. By you saying, I would like to see Mr. Smith, or what's even better is if you use their first name. Let's say their first name is John. All you have to do is walk in and say, hi, I'm here to see John. Most of the time, they will call John automatically. Now, if your gatekeeper kind of holds back and is a professional, and a professional gatekeeper they are, and they say, well, what are you here for? You're not going to start selling that gatekeeper, okay? You're not going to start telling them everything about your home health agency and what you do. Why? They don't mean anything. Why don't they mean anything? Because they're not the ones that are referring patients to you. So why are you going to waste their time? All they're going to want to know is who you really are. So all you need to do is tell them, look, I'm here to tell and talk to them about some patients. You are there to talk to them about some patients. So by you letting them know that, they will contact John or Mr. Smith. From doing that, you already have a name. So make sure before you walk in, just like anything that you do in life, you prepare yourself, you train yourself, you practice yourself for these type of objections. So you want to be able to get in there. It's a lot easier. Make sure you do a cold call first to gather more information.